Hello, and thanks for joining us. I'm Davina Campbell, and I'm a member of the Choctaw Nation of Oklahoma. On behalf of the American Indian, Alaska Native, Native Hawaiian Coalition, we would like to acknowledge the Creek and Cherokee Nation lands of which the CDC campuses are on. November is Native American Heritage Month, and we have several events planned to celebrate, honor, and share our cultures both historically as well as today. Information about other events will be in the CDC Connects and CDC Today, so watch for those and please join us for those events as well. The Coalition would like to acknowledge everyone involved for all their time and dedication to making this and all the events possible. Together, let's begin changing directions, which is often very difficult, but to move forward and to advance, we must. Today, we're talking about preventing violence, which has a direct connection to health and well-being. Today's panel brings together CDC and community members and is moderated by Dana Williams. Right now, together, let's change directions. Come on, let's join the panel now.
Good afternoon. I'm Dana Williams. CDC works 24/7 to protect America from health, safety, and security threats, both foreign and within the United States. Violence and the resulting trauma is a major public health issue. Indigenous people have suffered historical and ongoing trauma through multiple avenues, such as assimilation, language and land loss, forced placement in Indian boarding schools, racism, and microaggressions. Historic and contemporary violence experiences have contributed to American Indian and Alaska Native health disparities. To start discussion on this important topic, I'm pleased to welcome our panelists today. Our first is Delight Satter, who will be discussing racial and ethnic misclassification. Delight is a senior health scientist within the Office of Strategic Alliances in the Center for State, Tribal, and Territorial Support. She's a tribal member of the Confederate Tribes of Grand Round in Oregon. Welcome, Delight.
Thank you, Dana. I know it's a mouthful.
It is.
So I'm happy that to be here today to discuss this important topic on violence and missing and murdered Indigenous women. And it's my honor to be here as a member of the Confederated Tribes of Grand Round and as a direct descendant of the Umpqua. So people say, you know, what's the problem with data and Native data? And the issue is that decision makers use data for setting priorities and resource allocations and assessing the health status at the national level and at state, local, and tribal levels. So all decision makers want great data for their work. And we have limits with Native data. And they kind of range in a few different ways, but what's really important as a touchstone for public healthers is to know that Native people are a racial and ethnic minority group, as we're used to discussing in health disparities research or in other areas. But Native people are also the only federally recognized political minority in the United States. And so we have a unique need for data around our citizenry, and it has direct link to public health jurisdictions and other information that the rest of the panel will talk about later. But just keeping in mind, not just a racial and ethnic minority, but also a political minority. And then we have this data problem. So missing and murdered Indigenous women are further disappeared in data systems. And this is sometimes happening through not being counted in the first place. There's some systemic issue or a problem with the way data is collected, and so Native people don't appear in the system. The other major problem is being racially misclassified, not being noted as American Indian or Alaska Native, but being marked as some other race. And so those are two data issues that actually can be solved. And so we can work with OMB 15 and other technical corrections can be made. And CDC staff are experts in that area with racial and ethnic identity, as well as the collection of information, tabulation, and weighting of data in data systems.
Great, thank you so much. Well, next we bring to the conversation Dr. Phyllis Niolon, who will be discussing violence prevention. Phyllis is a behavioral scientist in the Division of Violence Prevention within the National Center for Injury Prevention and Control here at the CDC. Phyllis, welcome.
Thank you, Dana. Thank you for the opportunity to be part of this panel today. As Delight mentioned, data is critically important for understanding the scope of the problem of violence against women. We know that women and girls experience alarming rates of sexual violence, stalking, and intimate partner violence, both within the United States and across the globe. And we also know that American Indian, Alaska Native women and girls experience particularly high rates of these forms of violence. Within the Division of Violence Prevention at CDC, we have the National Intimate Partner and Sexual Violence Survey, or NISVIS, that provides national estimates of women's and men's experiences of sexual violence, stalking, and intimate partner violence. The most recent NISVIS data tells us that 1 in 5 women in the U.S. report experiencing rape or attempted rape, and that over 40% of these victims report first experiencing rape before the age of 18. We know that 1 in 6 women report stalking in their lifetimes, and that over 20% of these victims first experience stalking before the age of 18. And finally, 1 in 3 women in the United States report physical, sexual, or psychological aggression from an intimate partner, in current or former, in their lifetimes. And over a quarter of these victims report first experiencing this form of violence before the age of 18. While these numbers are staggering, American Indian and Alaska Native women experience even higher rates of violence. We know that from earlier data from NISVIS, 1 in 4 American Indian and Alaska Native women report experiencing rape or attempted rape in their lifetimes. 1 in 4 report experiencing stalking in their lifetimes. And half, or 1 in 2, American Indian and Alaska Native women report experiencing intimate partner violence in their lifetimes. Another important surveillance system that we have within the Division of Violence Prevention is the National Violent Death Reporting System, or NVDRS. A recent study of female homicides from NVDRS found that along with non-Hispanic Black women, American Indian, Alaska Native women experience the highest rates of homicide of racial and ethnic groups. Like other groups, we know that the majority of these homicides among American Indian, Alaska Native women are related to intimate partner violence, and fully 50% of women killed, American Indian, Alaska Native women who were killed by a current or former intimate partner.
Thank you for sharing that important information. Very, very critical.
Thank you.
We're very pleased to have members of the community with us, and I'm pleased to welcome Dr. Antony Stately, who will be bringing the community perspective. Antony is the CEO for Native American Community Clinic in South Minneapolis. Antony's tribal affiliation is Ojibwe and Oneida. Welcome.
Well, thank you, Dana. I'm really privileged and honored to be here today, and I appreciate the invitation from the CDC senior leadership inviting me to be here today. I think one of the things that's important to sort of call out is that this data that you just talked about is staggering, right? It's overwhelming. It's tremendously, it is just shocking to hear. What is also staggering for me is that I have been doing this work as a clinical psychologist and as a community psychologist for about 20-25 years. And this data is getting worse, it's not getting better. And so that's stark and concerning to me. The other thing that's concerning to me is that given what Delight has talked about in terms of sort of that these are not accurate figures, that we can estimate that the situation and the condition with respect to this particular problem is much greater in tribal communities and among American and Alaska Native women than we currently know. And that of course is compelling, right? We live in unprecedented times as well. Socially, across the United States, we live in a society that just devalues women generally. But we know that there are a host of historical factors and systemic factors that make this condition much worse in tribal communities for Native women specifically. And I'm hoping that we have a rich discussion about that today.
Wonderful. Thank you. Thank you so much. Now we welcome Elizabeth Carr as our final panelist. Liz is a Senior Native Affairs Advisor at the National Indigenous Women's Resource Center. Liz is an enrolled member of the Sault Ste. Marie tribe of the Chippewa Indians. Welcome.
Well, thank you, Dana. Thank you, Delight, and the rest of the team here for having us here from the National Indigenous Women's Resource Center. I just wanted to highlight the importance in understanding the unique relationship between sovereignty and safety for Native women, and mention that this crisis isn't new, that this crisis has been happening since contact, and that the results are of colonizing tactics. You know, colonizers targeted our women because women are the very foundation of a society. And so by targeting our women, they were able to attempt to decimate or, I guess, accomplish genocide against our people. And so this is a result of that ongoing attempted genocide. But in addition to that, continuing ill-conceived federal policies that continue to create issues in our communities and result in historical trauma, as Antony mentioned, but that contribute to the vulnerabilities of our community. So I just wanted to highlight that before we continue on with the conversation.
Thank you. So, what would you say is the intersection between data and the community? What can we do? Are we looking at data? Are we looking at stories from the community? Where do the two?
Well, I think an important thing when we ask that question about what is the intersection between data and the community is to recognize what Delight said, that data by and large drives the attention that a problem gets. So if her comment earlier was not lost on me, and hopefully it wasn't lost on anyone about this sort of the nature of how disappeared Native people are in data sets. So here we have a condition nationally where women are going missing and murdered and they're just gone. And we have no national data set that tracks that, right? There's been recent legislation that hopefully changes that. But the other part of that is that when you can't track a condition or a problem locally, regionally, nationally, you are oftentimes, your hands are tied with how you can marshal resources to address that issue. So that's why by doing something about the data is really important. It's really, really fundamental that we solve that problem because data drives the attention that something gets and it also drives the resources that are given to the problem.
Excellent point.
Absolutely. In my former life at the UCLA Center for Health Policy Research, our executive director, Rick Brown, would always say, no data, no problem. And so he would challenge me as a young researcher to focus on Native data. And we did. And so we came up with strategies and approaches to improving the quality of Native data in large data sets. And we continue that work today. So there are solutions to the data problem, either at the data collection side of things or in the way we report information. The other thing that made me think about this was the deficit model. So very often in public health we talk about that glass that is, you know, half full, empty. And
empty.
In Native communities and many other communities, we want to hear our strengths. We want to talk about our protective factors. We want to focus on the positive portions of the experience. And data can also tell that story. If we frame the way we're describing a problem that doesn't, you know, candy coat things, but that describes the protective factors, the strengths of the community, as well as the risk factors.
I think the other really important part of data is that when we have accurate data and then we implement prevention strategies, that data allows us to track the success of our prevention strategies. Are there things we need to tweak? Are there areas or certain groups of people for whom this is not working? Data is critical to those prevention efforts and evaluating those prevention efforts as well.
Excellent. Regarding data, I mean, data is only as good as the information that is gathered. What about people's ability to come forth with their information? How are we gathering that data? is there trust among the community to be open and honest about the disclosures of violence?
Sure. I think there's a couple of things that are related to that. One is that we have to do a better job of believing women when they say that they're being stalked or they're being harassed or they're being threatened or they're experiencing violence. We just, as a society, we have to do a better job of that broadly. In tribal communities specifically, I think one of the things that we need to do also is that we need to be able to make women feel safe, that they can actually report. Too often in the communities that I work in, or that I currently work in the other communities where I have worked in Los Angeles and a few other places, Seattle, the experience that we've heard from Native women is that when they do make those reports, help does not come, or they're not believed. And so if you have the repeated experience of reporting or asking for help and having help not come, then that can kind of tend to make people believe that what is the point of doing this? And sometimes, in some situations, it actually makes women more vulnerable, right? To do that type of situation where they report or they disclose and then appropriate help isn't given, it makes them more vulnerable to being to harmed and to being murdered.
I think it's important to also mention that there is a lack of adequate resources when it comes to victim services in Indian country, and then there's a lack of clarity as far as jurisdictional capacity goes as well, right? So sometimes you might report it to one law enforcement agency, but they might not track it, or they may not have the jurisdiction to follow up and prosecute the crime. And then in addition, we know that there's a lack of victim services. So a victim may not have somewhere to go, right? They may not have a place to access services, and so that's another underlying issue that creates vulnerabilities in our communities.
You mentioned jurisdiction. What are some of the jurisdictional issues that people need to be aware of?
So I think when we talk about criminal jurisdiction, there's a lack of clarity on who is able to prosecute who, right? So currently we have the Violence Against Women Act up for reauthorization, which in 2013 expanded criminal jurisdiction to cover domestic violence. And so, again, there's a little bit of a lack of clarity, but who is going to do the prosecution, the arrest, the charging of a crime creates a lot of issues. And I think Tom Cole actually said it best most recently at a VAWA, a celebration of the Violence Against Women Act, where he said, in relation to jurisdiction, fishermen know where to fish, hunters know where to hunt, and predators know where to prey. And for too long, predators have been preying in Indian country because they know that there are no repercussions as far as being held accountable for the crimes that they commit in Indian countries, particularly on our Native women. So I think that was a really powerful statement from him on the jurisdictional issues that we face in Indian country.
Sure. I think another issue related to sort of just understanding the jurisdictional issues as it impacts Native communities is that remembering that around 70% or so of Native people live off reservation and live in either urban or suburban areas or rural areas where they disappear in the numbers and the data. They're not perceived to be Native people. So they're stripped of they're recognizing that they have this dual citizenship, that they have some special protections that come along with that, and that's a really critical thing. But also broadly, when we were talking about structural issues earlier, one of the things is important to note is that out of all of the victim services funding that's available in the United States, less than half of 1% goes to tribal communities. Even though allocations and resources have been directed at those communities specifically, what we're seeing is less than 1% of the actual available resources go to those communities. So that really amplifies the condition and the problem even more, which is problematic. And so we have a lot of work to do from a policy side, from a data resourcing side, and then generally believing women when they tell them that they're being harmed.
Yes, very important.
I think another important thing to mention in relation to the data, we've known that this crisis has been going on for so long, and we've been sharing our stories with people on Capitol Hill, but stories don't translate to policymakers very well. And so we need data to be able to prove that we have these issues so that we can create better pieces of legislation to address our issues in Indian country. And so the importance of data in the legislative process and the policy making process is just paramount to being able to address this issue.
And we need communities and partners to help us interpret the data, to ensure that we are developing data systems or analyzing data in a way that's useful for communities. We can do it. We can analyze data that's useful for tribes at the statewide level, for federal partners, our sister agencies. We've done that recently with a technical assistance request from the Honorable Chief Justice Michelle Demert for her work with on behalf of the Haida and Tlingit tribes, as well as her work on behalf of the Senate Committee on Indian Affairs. And we were just thrilled to receive the request and to work with our partners at the National Center for Injury Prevention to get her the best data that she could take from CDC resources in their work at the national level.
We talk about violence against women. What about girls? What are we hearing about young girls, violence against young girls, and how are we capturing that data?
That's great.
Well, I think, you know, our Native youth are vulnerable targets as well, right? We have vulnerabilities in our communities that stem from, as I mentioned before, a historical trauma of colonization and other ill-conceived federal policies. And so there are vulnerabilities within our communities, and it leaves our young girls as targets. I will mention that just recently I had a conversation with a group of youth from a reservation, and they're actually the lead of the movement within their own community. And I think that speaks a lot to the strength and resilience of our Native youth. So while they are vulnerable and they are targeted, they're also recognizing the importance of this issue and really taking on a lot of the burden to end this crisis before it reaches the next generation.
Excellent.
And I think that's really important to mention, and that you know, we really respect them for that work, and it is just unbelievable to see their leadership. So I just wanted to mention that as well.
Excellent. The youth, the future.
Yes,
Yeah.
absolutely.
Yeah. I think one thing that I would want to say specifically related to girls or young women, you know, and I think of youth as all the way up to like sort of the age of 24. They say, in brain science researchers say, like, your brain continues to develop all the way up until you're 24. For some people, it could take even longer, perhaps. But I think one of the things that's important about that is to recognize that sometimes young people, they have a really difficult time estimating risk, right? So they overestimate their own capabilities a lot of times, and they underestimate risk. And that's true of everybody, but in tribal communities, we have had a historical sort of like impact of policies and things like that have made Native young women even more at risk. One of the things I think that's important for us to understand is that young Native girls who may have been removed from their homes, who are in sometimes foster care, we have some of the highest rates of out-of-home placement for young children in tribal communities. That continues to be a significant problem in our society today. Those young girls oftentimes are at prime risk for becoming victimized because they are outside of the reach of their elders and their community that would sort of kind of wrap some protection around them. And so that's an important thing to know and to sort of have some eyes on and understand. The other thing that I would say is that, you know, what we can do is we can encourage from a family and a community perspective to begin to help with intention have these discussions with our young women, right? I recently had a conversation with one of my teenage nieces who goes to school in inner city Minneapolis. She has to catch the bus and stand on the street corner in a very dense area of Minneapolis. And she told me a story recently about some boys who pulled up in a car and sort of like did catcalling, right? And then was trying to encourage her to, to accept a ride from them to her school. And one of the things I said to her is like, when those kinds of conditions happen, or those situations happen, it's important to do two things or three things. One is tell your mother or your parents, make sure that they understand that. Two, don't ever accept that ride because you don't know these people. And three, make sure you tell your colleagues, your peers about these situations, right? Begin to recognize risk where it's evident, and then rely on your family and your community to protect you, right? And we can do, that's something simple everybody can do.
The National Intimate Partner Violence and Sexual Violence Survey that I talked about earlier really indicates that very high percentages of women are reporting experiencing sexual violence, stalking, and intimate partner violence before the age of 18. And like Antony said, if you look at before the age of 24, it's generally the majority of victims are saying that they first experienced these forms of violence before the age of 24 or 18. So we know that these are happening to girls. I think it's important to think about some of the unique protective factors that girls in American Indian and Alaska Native communities have. We know that, for instance, a trusted relationship with a trusted adult is really protective against both perpetrating and being victimized from violence. And the youth relationship with tribal elders is a very important protective factor. We know that cultural and spiritual connection is also a protective factor against violence, and that's something that's unique and very strong within these communities as well. So we know that girls are at higher risk, that American Indian, Alaska Native women and girls are even higher risk than other members of the community. But there are many protective factors that we could capitalize on for prevention as well.
Thank you, thank you. Our community members here, do you have any insight in terms of other stories? You've told us about what some individuals have told you, but is there anything that you want us to know that you've heard from your communities?
Well, I've had some unique experiences over the last year in my role at the clinic that I serve Minnesota recently had one of the largest homeless encampments it's ever seen in its history as a state. I think broadly, another risk factor related specifically to that is that to this issue that we're talking about is just the high rates of homelessness and poverty and a few other things that tribal communities experience. So when you don't have a home and you don't have a job and you have no money, it makes you more vulnerable to sort of being preyed upon, right? If you have limited resources to solve those conditions, you may have to make some calculated choices about what you're going to do to solve those conditions for you or for your children. That makes Native women very, very vulnerable, right? It's hard for anybody, I think, in any situation to do a risk calculation in your head on the fly, right? When a truck pulls up on the side of the street, right? That's what we're talking about here in the community. And so part of that is beginning to recognize the conditions that place women at risk and then helping us to come up with solutions as a community to solve that condition. So this large encampment that was 3 blocks from my clinic had lots of people sort of scratching their heads like, why are all of these people congregated in this small stretch of land, this 1/2 block of grass, 400 people living in tents? The majority of those are Native people who are homeless. Well, one way of thinking about it is that's a serious problem. These people have this condition or that condition and this social ill or that social ill. But the other thing that camp symbolized was that Native people wanted to live near and around each other because they wanted to live near and around the service organizations that served them and knew them well. So they congregated and lived nearby and near one another and near organizations that would support them and help them. And that was a community solution that they themselves came up with. It was, you know, born out of experience, and they said, this is the safest place for us to be, rather than being dispersed across the Greenway or a few other places. So part of that, I think, begins to understand is like, people usually know well how to solve a condition or a problem in their own community if they're given the resources to solve them. Now, was that the best solution? Probably not, because we also knew that in that encampment there was lots of violence being conducted or directed at women even in that condition. But what women were empowered in that situation to do was to be able to speak to that. And what we saw in the response community-wide was Native people listened to Native women when they were telling them that they were being victimized, and they responded. And by and large, the majority of the people in the community that really drew attention to that and did something to marshal resources were, of course, also Native women, right? Native women are solution makers, quite frankly.
I think that speaks a lot to what we, as an organization, speak to a lot, which is Native communities know how to address Native issues, and so we are the best to be able to solve the situations that are impacting our communities. And I did want to share, when I was speaking with the Native youth just a few weeks ago, one of the young ladies asked me if our communities are too broken to address this issue. And the answer is absolutely not, right? We've survived attempted genocide, we've survived hundreds of years of oppression, and we're still here. And as Antony mentioned, the group in Minnesota knew to band together to create a community-based solution, and that's exactly what we need to do in our communities. And so I thought it was important that she asked that question and be able to let her know that no, we still know. Our Indigenous ways of knowing are the right way to address the situation. So I wanted to mention that as well.
Thank you, thank you.
I think it's also important for that young lady and other young Native women to understand, specifically with this respect to this condition, is that it's not our communities that are broken, it's the systems around us that are intended to support us and provide us with resources and provide us with the capital to be able to respond to those kinds of things, and the opportunity to change policy that will actually have real results. That system is broken, and that system needs to be fixed, right? It's nothing inside her specifically or within our specific community that is contributing to this problem.
Right. And that moves us to the public health framework, which is, you know, our model. We don't do direct services out of our agency or our partners. It's primarily around public health prevention. And so collaborating with communities on the prevention of some illness or disease, like violence, or the promotion of health, the counter, before anything even happens.
Right.
I know we wanted to talk about that today also, but before we do, I wanted to share with the audience that there is a group of Native traditional leaders and public health practitioners who developed something called the Native American Cultural Wisdom Declaration. And it is a very useful guide for public health, for me in my work and others across HHS, for ensuring that we are understanding and respecting traditional ways of knowing, that tribes and urban communities have knowledge and resources to develop and implement public health solutions in the community, and that it is deeply grounded in traditional ways of knowing, and how wonderful that is. But then Phyllis and I, you know, we're over here, we're also like these public health scientists, right? And we also know that the best public health, no matter what community, is always local. So you can come in with excellent public health theories, you know, models, but those have to be adapted and applied in the real world experience outside the ivory tower, outside of Atlanta, at the community level. And that's wonderful. And it's not a competition, and it's not a trade-off. You're not saying no to science and yes to tradition. you're combining the two in wonderful ways and measuring success, finding where to tweak it as needed. And so I thought we could maybe talk about some prevention and models.
Yeah, I think that's so important. As Liz was saying, the solutions are known within the community. And as you were saying, we really have to start with the community to take a public health approach. But preventing violence is everyone's responsibility. It can't be solely placed on tribal communities and American Indian, Alaska Native communities to prevent the violence that's happening to them. Sometimes it's happening well outside of their communities and being perpetrated against them from outside their communities. And while victim support services and criminal justice solutions and jurisdictional issues are critically important, if we want to solve the problem of missing and murdered Indigenous women and girls, we have to prevent violence before it starts. We have to prevent the perpetration of violence. It's not enough to try to help people not be victims of violence, because when we do that, we're really just shifting the focus of the violence somewhere else, right? So it's important to focus on primary prevention, stopping it before it starts, and really preventing perpetration of violence. In the Division of Violence Prevention, this is what we focus on, and we recently published 5 different technical packages, which are technical packages based on the best available evidence to try to help define strategies and approaches that communities can use to try to prevent violence. And there were 5 different technical packages, and 2 of these are focused on the prevention of sexual violence and intimate partner violence. And American Indian, Alaska Native communities can look at the strategies that are outlined here, decide what is the best fit for their communities, and know that all the strategies and approaches there are based on the best available evidence. They either have evidence of having a direct impact on sexual violence, stalking, or intimate partner violence, or direct evidence on a risk or protective factor for violence. There's also a tool that's an online resource tool called Violence Prevention and Practice that really helps communities use these technical packages to decide what's the best fit for their community and to understand what strategies impact which forms of violence.
And would they be able to find that right on the CDC website?
Yes, thank you for asking that. That's available on cdc.gov/violence prevention. Excellent. All 5 technical packages plus the other resource tools.
Great, thank you.
You know, I really loved what Delight said, and also to amplify what you're discussing here too. Like, I think one of the things that's unique about Native communities throughout history, we are scientists as well, right? We know some things. We know some things that work. We know that they work because we've done them since the beginning of time. You know, storytelling is one of those things. Storytelling is actually a protective factor, right? When we share stories, we're sharing wisdom and knowledge and experience and all kinds of other things. So that's important to do, is to tell these stories. One of the things I think that's important to say is that tribal communities can be supported greatly by the CDC and other federal partners by not always just sort of only funding evidence-based interventions, right? And what I mean by that is that, you know, that gives us the opportunity to sort of kind of pull on science, but we also need to be able to sort of amplify lived experience of Native people by funding and supporting practice-based evidence. Things that we know work because they've worked since the beginning of time. And Native people, that's who we are. You know, since contact, not only has violence happened, but we've also taken things from the colonizer or from our visitors from the West and used those tools, not in the way maybe that they designed them to be, but we use them to function for us. So that's kind of like the analogy here is that what you used when you said, well, we can develop these things, but they have to be implemented locally, and we have to trust people at the local level and at the regional level to be able to do that and do that well develop solutions for their own communities. We've done that since the beginning of time. We also have done that since contact. You know, we've taken tools that the Western people have brought to us. A good example is the horse, right? You know, that was not something that's from this continent. When it was brought over, not only did Native people learn to you know, domesticate the horse and use it. They used it well. They were great hunters. They were great warriors, all using the horse. That's an analogy that helps us to begin to understand, like, trust Native people to know what works for them. And I'll take a tool, and I might not use it in the way that you designed it, but I'll use it in the way that will work for me, and I'll find a solution.
Very important.
So I think we have to do more of that.
We welcome that.
Yes.
Yes.
I would like to say, just to amplify Delight's point, I think it's important that CDC promotes that work across other federal agencies, because that's not the vision that a lot of other federal agencies take when working with Indian country. It's very prescriptive and really kind of opposed to traditional ways of knowing or Indigenous practices, or just being able to be flexible with tools. So I think it would be really helpful if CDC were able to just promote that a little bit further outside of the CDC lane, so other agencies are potentially more open to tribal communities utilizing funding and tools in the best way that they see fit in their communities. I think that's really important.
Excellent. And you know, we have many of our sister agencies tuning in today, so take note, sister agencies, good information. Very good information.
Yes. Thank you.
So, stories. Do we have anything else that you want to tell us from the community?
I think one of the things I think that's also important to talk about, and this speaks probably more less to our federal partners, but to local jurisdictions, because this is also where we're going to see some real opportunities for change. I had a recent experience where a couple weeks ago, where I left my clinic at the end of the day, and there's a grocery store in the same parking lot as my clinic, and I walked over to the grocery store, you know, to get some milk and some bread, things that I needed for the next morning, you know, to get the kids off to school kind of thing. And I was checking out, a young woman approached me. She must have been like in her mid-20s, maybe late 20s at the most. And she walked up to me and she said, "Excuse me, but can I use your cell phone? I need to call the police because I'm being followed and I'm scared. The people who followed me are in the store. I think they want to hurt me. I think they're trying to harm me." And so I checked out and I walked with her to my car, and I said, you know, can you tell me a little bit more about what's going on with you? And she was able to describe, like, you know, that she had come from a particular part of the city, a few blocks away, about 6 or 7 blocks away, a particular part of Minneapolis where we're having a significant challenge in our community around drug trafficking and human trafficking, and the confluence of that, and along with homelessness and the risk and vulnerability that some of the things that we're talking about today, right? We have heard stories ever since the homeless encampment and a few other things that have happened in Minneapolis of men just driving up in dark SUVs and grabbing women right off the street and throwing them in their cars. And those things happening all of the time. So when she asked me for my help, I knew this was happening in our community. I knew that it was possible and potential. And you know, what I did was I wanted to do everything I could do to support her. So calling the police was not going to solve the condition, because we have response issues in our local jurisdiction that are upwards of 2 to 3 hours for what we would call as a non-violent or a non-emergency call. That's a real condition in many urban and metropolitan areas that we need to solve broadly. I walked her back to my clinic, and I engaged a patient advocate and some other staff to try and provide support to her. Let's see if we can find her a shelter because she's homeless. Let's try and see if we can find other places where she would feel safe. My staff had one struggle and one barrier after another trying to find this woman some support and a safe place to land for the evening or for the weekend. It was also a Friday evening. And I think that's part of what we need to do also locally with our city and our county and our regional sort of structures is to begin to rely on them to be able to help us with this problem, right? We can't solve this condition or this solution alone, but one of the things that they can do is they can begin to recognize that they have some solutions to offer. They can start to believe us when we tell them that our women are vulnerable, that our young women are vulnerable, and they can also do something to change that.
So very wonderful that you were there, number one, and the young woman thought to speak to you. So that was very important. So we applaud her for even reaching out to you, and thank you for what you did. On the issue of untimeliness in terms of responsiveness, what has the community been doing? Has there been any discussion with law enforcement about that?
Well, you know, what I would tell you is that, you know, I'm really proud to be from Minneapolis, and specifically from Minnesota, but also specifically from Minneapolis, because we have, I think, mobilized locally. We have an organization called the Metropolitan Urban Indian Directors. That organization is made up of 25 or 30 some odd directors, executive directors of Native serving organizations in the metropolitan area. We have a memorandum of understanding with the city of Minneapolis, that the county, Hennepin County, and then also in some respects the state has sort of begun to sort of adopt and sort of, if not ipso de facto, they kind of behave that way. They come to us and they ask us, we want to do this, or we have this issue, or we have this problem. We'd like to get your input on how to do this and do this well. So that's a start. Like, local jurisdictions can consult with tribal leadership or other leaders within a specific community. Communities themselves can also try to come together and work collectively. This relationship, the Metropolitan Urban Indian Directors Group, has been in existence for about 40 years in Minneapolis. And each successive governmental structure has honored that agreement historically, and our new mayor, Jacob Fry, has been really great at supporting that relationship and trying to move the needle on that in terms of solving problems. Is it perfect? Absolutely not. Nothing is perfect. But I think, and sometimes that's where we end up getting stuck in the mud when we're trying to figure out, like, what's the perfect solution here? Like, everybody would like a silver bullet, right, for this particular monster. But there is no silver bullet. Like, it's going to take everybody working on the problem, and it's going to take everybody working collaboratively, and being willing to try something and have it fail, and then redouble our efforts and address it again, and don't get discouraged, right? That's what it's going to take.
Excellent. With our remaining time that we have today, what do you want our viewers to know? Is there anything else that you want them to know that we might not have touched upon today?
You know, many of our audience are HHS friends, either at CDC or HHS. So I want them to know that our office, the office OTASA, the Office for Tribal Affairs and Strategic Alliances, is your navigation hub. It's also where tribes and urban Indian programs, you can just call me or call that office, and we'll help navigate the resources across all of CDC's centers, institutes, and offices. There are many. So that's the navigation hub, and we love receiving technical assistance requests. The scientific community at CDC loves partnering and collaborating with the public, and we don't always get that opportunity, but we're happy to do so. And so I think that's the important message for our office and for CDC. And also, as we receive those requests and as we build relationships, even if they're virtual, you know, Skype or whatever. I mean, I've known Tony for over 20 years. Well, maybe 30.
Possibly 30.
And I've known
We
Liz
were very
now.
young when we
were
met.
so young.
Yeah.
We were children. And
12.
Liz for closer to 10. And so we have established relationships. And it's very typical for Native people to build a relationship and continue that relationship. And so our office wants to do that with tribal communities and urban Indian programs as well. And we know it's just not that simple. We know that there is a long history of federal policies that were harmful to Native people, and it's going to take a lot of work and time and trust building and relationship building. And we're for that. That's what we're here for.
Excellent, excellent, thank you. Phyllis, what would you say?
Yeah, I'd say my takeaway is related to Delight's. I would just really emphasize that violence is preventable, that this problem of missing and murdered Indigenous women and girls is big and overwhelming, but it is preventable. And I think it's important for CDC and other federal agencies who are working in this arena to partner with tribal communities to help them understand what tools we have available and capitalize on their expertise in their communities to try to determine the best strategies for preventing the problem of missing and murdered Indigenous women and girls.
Excellent, thank you. Antony.
I want to close by saying there's a Cheyenne proverb that says, a nation is not defeated until the hearts of its women are on the ground. And so for me, it's stark and it is compelling that what's driving the missing and murdered Indigenous women movement is Indigenous women themselves, right? And that speaks to the strength of our women, it speaks to the strength of our community. And so I want to amplify that before we leave. The other thing I want to encourage our viewers to recognize is that it is important and it's incumbent upon every single one of us to do something about this condition. Not just for Native women, but for women broadly, but specifically with respect to Native women, we can do something, every single one of us can do something. If you're tuning in today, you're already doing something because you're building your awareness. The next thing you can do is you can do a little bit of research. There's a lot of information on the web now with respect to bills that are being passed and introduced and things that are happening at local and regional as well as national levels. Educate yourself and become more knowledgeable about it so that you can speak fluently and logically to the conditions and the issue. The other thing that you can do is you can talk to at least one other person about it that might not know about it, right? So that you can do that. And the last thing you can do is you can believe women when they're telling you that they're being harmed, or they're being threatened, or they're being hurt, or they're being stalked. That's a really important thing for us to begin to do. Every single one of us can do that.
Yep, it's all of our responsibilities.
Yes.
And
I think
Liz.
I'd like to close by saying this crisis didn't happen overnight. That's not going to be solved overnight, but every step forward matters. And I think even having a panel discussion here at CDC for the first time ever is a huge step forward. And moving forward, just with other federal agencies, latching on to what CDC is doing and understanding and trusting our communities to do the work to be able to start solving this crisis. So that's what I'd like to close with.
Thank you. And, you know, I think we've talked a lot about trust and building trust, and I think that that too is incumbent upon all of us to start that discussion and move the dial on trust and know that we can be trusted as federal agencies. I know it has not been easy in the past, so anything that we all can do collectively to start to move that dial would be greatly appreciated.
Absolutely.
Other thoughts?
I think it's, with respect to trust, I think it's important that we also, you know, we're speaking primarily broadly here to to the HHS staff because it's, you know, but I know that other people are listening. I think somebody told me earlier we had like over 290,000 hits or something like that, which is a little bit overwhelming as I sit here in front of the camera. Yep. But I think one of the things, and hopefully some of our local partners and our state partners are listening when we say yes. that, that long history of policies, enacting policies and making laws and making decisions and determinations that have disempowered and actually victimized Native people as a class of individuals, the responsibility to change that is incumbent upon them, right? They hold the power in these situations oftentimes with respect to resources, and so they have to work twice as hard as the community. I think I come from the community, and I think what community feels like is they've come to partners many, many times only to be not heard and not valued and not supported. And so in a trusting relationship of any kind, you want to see those things materialize and manifested in a relationship, right? Much like you would want in an intimate partner relationship, yep. right? Yeah. I think one of the other things when we were talking about trust, and I forgot to say it earlier, is that I think we also have to help our young people begin to understand who is trustworthy and who is not trustworthy. In a traditional society, when you were raised by your grandparents or your great-grandparents in a closed community where all are relatives, that would have been a process that would have been instilled in you from birth. But we've had a history of colonization and policies that have broken our ability as a community to be able to instill that in our young people from the beginning of their life. And so we have to do something different in our communities where we, with intention, try to grow that and strengthen that for our young people so that they know who they can trust. Excellent. When they go to an elder or they go to this person or that person, they can recognize who is trustworthy and who is going to help me. Mm-hmm. And that's a really important thing to teach people.
Thank you, thank you. And as we mentioned, this is the start of this discussion, and I thank you so much for being with us today. My esteemed colleagues, our wonderful members from the community, we could not have done this without you, and we really thank you for your time and your takeaways. This is so important, and I hope that our viewers have really listened and heard what the takeaways or really calls to action are going forward. We have provided for our viewers a slide that lists many resources. Please look at those resources. They will be posted for you to reference. The big takeaway here is speak up. Listen. If someone tells you that they're being abused, please listen. Believe the person. It's going to take all of us to address violence and, really just take heed of that. Thank you, panelists. Thank you for being here. We bid you safe travels going home. And thank you.
Thank you.
Until next time. Thank you. Thank you, viewers.
Thank you.
Thank you. Great.